Hi, everyone. My name is Marcella Pomeranz. I'm a nurse practitioner for a large GI group named Digestive Associates out of Las Vegas, Nevada. I've been practicing in GI for over 8 years. I'm our lead nurse practitioner, so I'm in charge of a dozen APPs, and I have a strong passion for educating and advocating growth in our community. So today I want to talk to you about a popular misconception that patients bring up to me when I tell them they have steatosis or steatohepatitis. A lot of them say, but I don't drink. Or they think, well, I'm not going to get cirrhosis. I don't consume alcohol. So patients think that people who consume only large amounts of alcohol get cirrhosis. And we know that that's not true. So according to the NHANES data, the prevalence of steatosis in the US is estimated to be nearly 38%. And the cause of that almost always is MASLD, about 32% of patients. And then alcohol and MetALD, so metabolic and alcohol consumption, kind of that gray area where they have both risk factors, accounts for less than 4% of patients with significant steatohepatitis. So we definitely need to make sure that patients are aware that there's multiple causes other than alcohol and that they're still at risk for fibrosis if we don't get them optimized. So the other causes, we know MASLD is the biggest one, right? It's strongly associated with metabolic syndrome risk factors such as high blood pressure, cholesterol, hypertension, but we have other things too, right? So viral hepatitis, autoimmune hepatitis, and autoimmune biliary conditions like PBC and PSC. There's genetic disorders like Wilson's disease and hemochromatosis that increase fibrosis risk. And then even toxic medications, methotrexate, NSAIDs. A lot of people take NSAIDs daily for chronic pain, but they don't realize the damage that they could be doing to their liver. Everybody thinks that because it's over the counter, it's not really going to hurt them, right? And we can't ignore the genetic and ethnicity risk factors. So our Hispanic patients, those are higher risk of fibrosis and cirrhosis. So why does this matter so much? One, because patients undermine their disease. They don't think it's a big deal because they're not doing anything actively, like drinking a significant alcohol that may increase their risk. It may delay early detection because they may think that their primary is not looking for it because they don't drink. It may also delay care or allow to progress for extended period until now all of a sudden their liver enzymes are high, their platelets are low, and they were like, where did this come from? I've never been told that I had any significant issue with my liver. We also don't want to think that hepatic steatosis and cirrhosis are always self-inflicted, right? But there's a stigma associated with that. So I think it's really important for us to be educating our patients that alcohol may not be the reason why they have their steatosis. And it's not likely to be a considerable factor given the data that we have in our NHANES studies. So I think it's really important for us to be telling our patients about their metabolic dysfunction being their biggest risk and making sure that we're working to optimize that to help reduce the risk of fibrosis and cirrhosis. So thanks again for listening, and I hope you guys have a great day.